The governor says that legislation that would stop parents from objecting to vaccines for their kids is legally questionable. Now, the talk comes during a recent surge in measles cases. The governor says eliminating religious exemptions could face a First Amendment challenge. Now, lawmakers in other states are considering similar moves, calling the increase in measles cases a serious public health concern. And there are no cases of the measles here, but that doesn't mean that there isn't a plan in place. And News Channel 2's Reed Kisselback takes a look at the procedures local health officials would follow.
Right now, there is a measles outbreak in downstate New York, and that leaves a couple people wondering locally, what are the precautions that we are taking in our area?
Just general education, making sure people are aware what measles is, making sure they're checking if they're vaccinated or not, and just basic education to get people aware.
For those of you that don't know, measles is a contagious virus that usually starts out as a fever with a runny nose, sore throat, and red eyes. But 3 to 5 days after, you'll see a rash appear. So what happens if we do get a case of measles in our area?
The doctor's office or the hospital would be calling the health department right away, and the health department would advise on the testing recommendations for the person who's sick and then control measures to help prevent the spread of disease within our community. And all the control measures that we would recommend would just vary based on the case's age, whether or not they're vaccinated, and what kind of setting they were tested in.
In order to protect yourself, doctors say you'll want to get the vaccine.
The big reasons we want to keep people vaccinated and we watch out for the measles is because it can have some pretty serious consequences if you get the actual infection. About 1 in 20 people who get the measles will end up getting a pneumonia from it. And this can be both a viral pneumonia from the measles itself, or the measles does enough damage to the body's immune system that a bacterial pneumonia can grow on top of that. And these pneumonias are actually the leading cause of death, especially in children, for the measles.
And that vaccine is 97% effective against the measles virus. In Oneida County, Reed Kisselback, News Channel 2.
Coming up here tonight.